Protects his puppies by biting between the big and small toe of the assailant. This will help you remember that patients with Down syndrome often have a wide space between their big toe and the adjacent second toe. So biting between the first two toes stands for increased space between the first two toes. Now the puppy's mother is trying to carry them away from the fray. And as dogs do, she picks them up by gently biting the nape of their neck, or the nuchal region. You can see this nuchal skin on this puppy all stretched out. This will help you remember that fetuses with Down syndrome often have nuchal translucency, meaning that fetal ultrasounds will reveal a translucent nuchal region, making it look bigger and stretched out, kind of like this dog. Stretched out nuchal region on this puppy stands for nuchal translucency on fetal ultrasound. And scared of the ferocious dog biting his friend, another mugger panics and trips. Thankfully for the family, he smashed and bent his double-barreled shotgun. Double kind of sounds like duodenum. So the double-barreled shotgun should help you remember the duodenum. And the fact that the double-barreled shotgun is bent up and totally blunted will help you remember that patients with Down syndrome often have duodenal atresia. So blunted double-barreled shotgun for atresia of the duodenum. Hoping to avoid getting caught by law enforcement authorities, another bandit is attempting to escape on an ATV. As you can see with the smoke bursting from under the hood, this ATV is not working. This will help you remember that patients with Down syndrome often have atrioventricular cardiac defects. So broken ATV for atrioventricular defects. Now the bad guys are trying to reach this river to escape. Notice that things didn't work out for this guy. As you can see, he's floating face down in the river, surrounded by his own blood. This bloody river will help you remember blood cell cancer, or leukemia, which is quite common in Down syndrome patients. Now there are two types of leukemia to remember: acute myelogenous leukemia and acute lymphoblastic leukemia. We have a memory hook for each one of these. Look at these mile markers along the river, and notice how each mile marker has a little pink ribbon tied around it. Pink ribbons such as these are often used to represent hope as it relates to cancer. So we like to use pink ribbons to represent cancer. And in the context of a bloody river, this should help you remember that we are dealing with a blood cancer, leukemia, specifically myelogenous leukemia. Remember myelogenous because of the mile markers. And patients with Down syndrome have an increased risk of acute myelogenous leukemia, or AML. So again, pink ribbons on mile markers for acute myelogenous leukemia. And the second type of cancer is acute lymphoblastic leukemia. And the lymph in lymphoblastic refers to white blood cells. So let's discuss this guy with the rocket launcher a little bit more. As you can see, this launcher has blasted a white rounded rocket at the helicopter. The round and white nature of the rocket resembles white blood cells, or lymph, as in acute lymphoblastic leukemia. So again, the white rocket blasting against the helicopter stands for acute lymphoblastic leukemia. And with the helicopter spinning out of control, we can now see why this guy was falling down. Remember that guy falling from the sky? Our Down syndrome guy? Well, he was trying to stop the bad guys. As you can see with his gun falling through the air and the dead body in the river, it looks like he was successful in taking out at least one of his targets.